Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up, as always, and I think you are, too.
Absolutely. We want our listeners to live it up, so we want them to call and talk to you right now at 866-870-5752. And when you call us right here at the station, you get your free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is written by Suzanne Summers, and it has 264 scientific studies. Did you know that?
I think I remember that when I was writing it.
I knew you'd like that. So Suzanne actually put you in her book. The most recent one by her is A New Way to Age, and you actually got quite a spread there on page 302 to 316. And
that's right.
So you two go way back,
Oh,
helping
yeah.
each other.
We've known each other for years and years and years. Actually, I'm looking at the inside of the book that she wrote a little message. I haven't seen this in a while. Let me see what it says. Hi, Mark. This is just for you. Oh, real books come soon. I don't know what that means.
Oh, that's probably
this
a
is,
galley or something.
Yeah, this is a galley she sent me. You're absolutely right. Yeah, Suzanne Summers, shout out to you. God bless you. We love you so much. Suzanne Summers, for those of you that don't know her, is an advocate of medicine that is natural. And that's what my work is involved with, natural medicine, which is healing the body using cells from your own body. I know that seems hard to understand when we live in a world and a culture of surgery and medication. That's how we grow up. That's what we think is correct. When I was a little boy, I always wanted to be a doctor. And our family was involved in medicine. And the people that we prayed to the most were the surgeons. We thought they were just gods at that point. And things are changing, though, over the years. I've been a proponent of, actually, my whole life. I had a surgery on my right shoulder when I was in medical school that really jacked it up pretty badly. And I learned the hard way that surgery is not always the answer. And in fact, when it comes to musculoskeletal issues, neck pain, back pain, all the joints, tendons, ligaments, I am not a proponent of surgery unless it's absolutely necessary, which it is a lot of the time, and which it isn't most of the time. So that's just me talking. You don't have to believe me. That's been my experience. I've been in medicine a long, long time. And since my shoulder was operated and injured by the surgery, I was looking for another way to heal, and I found something that we now call regenerative medicine. Back in the early days, we called it prolotherapy. Prolo from the Greek word proliferate. And what we do, us regenerative medicine docs, is we stimulate the body to produce its own natural healing and produce more tissue. Collagen is the structural protein of the body, and we know how to stimulate more collagen growth. It's that simple. So let's say that you have meniscal tear in your knee. Can that be healed? Yes. Do you have to put a knife in it to fix it? Nope. And unfortunately, a lot of my patients who come in, I have new patients every day, and a lot of them have had a failed surgery to the knee, shoulder, neck, back, wherever it is. And they're in a quizzical state, ask me, why did the surgeon say this was going to fix me and I got worse? I see it all the time. So I do have a jaundiced eye about surgery. I have to admit it. I had a bad outcome myself, and I see patients all the time with bad outcomes. I'm not bashing the surgeons at all. I love surgeons. I think they do the hardest work in medicine. You've got to have a lot of guts to go into surgery. I did a lot of surgery myself when I was in medical school and internship. And even before medical school, I would beg orthopedic surgeons, buddies of mine, to let me come into surgery because I loved it so much. And I was on the path to become an orthopedic surgeon until my shoulder got jacked up from a surgery. And I loved my surgeon, I still do. It's just that they don't come out the right way sometimes. And we get callers all the time giving their stories of how they had surgeries that didn't work. Sometimes we get callers who say it did work. But I look at it like gambling, and I'm not a gambler. I don't like gambling. I don't like Las Vegas. Yep, I don't like Las Vegas, folks. I don't like to put money down thinking I'm going to lose it, even with the thought I might make a lot more. My experience and the studies that are actually in my book, which we're going to give you a free copy of if you call in and speak to me right now. So I'm going to give out the phone number to the studio, and you can call me right now. Dr. Gene, who was my radio host years and years and years ago, used to say live and local. Did you ever hear his shows, Nita?
I did.
He was such a great guy.
I met him.
Yeah, that's right.
I met him a couple times at your house, and I also really felt so honored to replace him because he retired. So
he did. He's a great guy. Dr. Gene, if you're listening, God bless you. You're a great man. Dr. Gene owned like a dozen pharmacies. He was what we call a frustrated MD, like the pharmacists usually are. They know an awful lot, but they don't get to really practice medicine. And the days of the old-time pharmacist where they'd sit and counsel you and tell you how to live your life and do what's healthy for you are kind of gone today, which is too bad. Anyway, the number to the studio right now to speak to me is 866-870-5752. Go run and get your pen and write it down. I'm going to give it to you again because I want to talk to some people. I have a lot of questions waiting here until we get some callers, but I love getting callers in. You can stump me with any kind of musculoskeletal medicine issue, anything about orthopedic surgery, neurosurgery, things of that nature that you're involved with, parts of your body. And I always tell people, if you're shy, still call up. We're going to still love you, and you can pretend that it's your father that has the problem, or your brother, your sister, your wife, or whatever that is. And you can even give a fake name. We don't really care. So the number to the studio again is 866-870-5752. I'm going to give out another number, too, for those of you that are shy. You can call the office and get more information that we don't talk about on the show. And that number to the office is 800-300-9300. I'll repeat it again. It's 800-300-9300. And for those of you that are computer savvy, you can go to the website, which is www.lastemcells.com, www.lastemcells.com. And you can actually watch me doing these procedures. I have a lot of videos on there, and see if it's something you want to do. I like what I do. It's simple. I'm a simple person, and it's simple in the sense that a patient will come into the office, they walk in, they'll get some injections of cells from their own body, and they'll walk out. There's very minimal side effects. There's a little stiffness afterwards, which I akin to a workout. When you work out, you get a little bit stiff afterwards, and that's what it feels typically. Some people don't feel anything afterwards. Some people feel better afterwards. It's just hard to predict what will happen with the person. And people always ask, they say, how soon am I going to feel better? And I don't have a crystal. Actually, I have a crystal ball. I use it for decoration, but I love crystal balls. I lived in Berkeley, California, which was the center of all that type of stuff. So I love crystal balls and I love all of that, but I don't know how to use one to find out what your future will hold, what we call the prognosis. So what I tell people is there's no guarantees with my kind of medicine, but there's no guarantees with any kind of medicine. And a lot of surgeons tell my patients, well, this can't work. You can't grow cartilage. Well, that's not true. I've got a whole book of studies here that you're getting a free copy of if you call me up right now. And the number again to the studio is 866-870-5752. I want to talk to you. Please call. In the meantime, Nita, do you have anything to say before we go on to some questions that I have?
Yeah, I really, I always get copies of your book because I hand them out to everybody. I mean, strangers in parking lots that I see limping, I hand them out. And it's really, you've just got to read this book. 866-870-5752 is our number. You do get the free book when you call. And if you've just tuned in, it's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the foreword is written by Suzanne Somers, who, if you don't know who she is, she's an actor who's been writing books about health, natural methods to get healthy for decades.
Yeah, she's amazing. Just amazing. Suzanne Somers, I love you. And I think every doctor who does natural medicine loves you because you've helped all of us get out to the public. All of her books have chapters by different doctors, and it actually gives their protocols. So oftentimes you don't even need to go to the doctor. You can just follow what the protocol is to heal. So it's pretty amazing stuff. So I'm going to mention a couple things, then get to some questions. Hopefully we get some callers by then. We do something called the vampire facelift in the office, is using platelets or stem cells, inject them into the face. Very quick, simple procedure. That also grows back the collagen in the face, makes you look young. And we do it on the top of the head to help regenerate hair. So here goes a question. You ready, Nita?
Ready.
Okay. You want the kind of question that is going to make you laugh, or you want a kind of question that gives us some medical information?
Listen, everything makes me laugh. It's your call. I'm happy no matter what.
Okay.
Even when I miss all the answers and feel like a fool,
No,
I'm a happy fool.
You got two correct answers last time. So
I did. That was amazing.
Here we go, Nita. Where does the electric cord go to shop?
In the plug.
You're very close. An outlet mall.
Oh, that's where I shop. I'm in.
That's right. Okay, the next one. Why are frogs so happy?
They're leaping all the time.
Yes, they are. They eat whatever bugs them.
That's a good one.
I really do that just to hear you laugh because you have the cutest laugh of anybody. It's very sweet.
Well,
all right,
you.
so I'm gonna go to a question right now. This says osteoarthritis in my right knee. So it goes on. By the way, people email me from the website all day long, all night long, from all over the world, and I answer every one of them. Okay, so it says, my friend said that 10 years ago you treated his knee, and he was very pleased and still happy with the outcome. I have osteoarthritis in my right knee, looking for ways to improve it. Can stem cells help? Usually, yes, but I'm not going to tell anybody over the radio that I can help them. And, we need to do an examination. When I get emails from people, they often are accompanied by an MRI or an X-ray, and they say, so can you fix it? And I tell them that I don't know the answer to that without an examination, because you can have a terrible looking MRI and have no pain. And you can have a great looking MRI or X-ray and have terrible pain. They don't necessarily correlate, okay? I still like to get them. I like you to bring them in when you come in so I can look at them, because there's a lot of information in those studies. But I don't treat based on them, if that makes sense. So as an example, a lot of people come in with labral tears in their shoulder or labral tears in their hip joint. The labrum is a coating around the bone that helps hold the bone into place in the joint. Labrum comes from Latin, meaning lip. Labrum is lip in Latin. So it's a lip all the way around the bone in the hip joint. It's the humerus bone. I'm sorry, that's the arm in the shoulder. In the shoulder, it's the humerus bone. That's the arm bone. And in the leg, in the hip joint, It's the femur. So the problem is this. If you Google labral surgery, you're going to find out that the outcomes are not very good. And my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, has a lot of these studies in there showing that these labral surgeries are not good surgeries to do. My book also shows you that most of these little surgeries for meniscal tears and tendon repairs and things like that, joint replacements, are not that great. They sound great because it sounds like you're going to come out better than you started. But unfortunately, my clinic is full of people that had these surgeries where the surgery failed. And I say this on most shows. I'm going to, in case I haven't said it lately, I'm going to say it now. The insurance companies actually have diagnostic codes for failed surgeries. So, for instance, failed back surgery is a diagnostic code. What that means is there are so many people that have surgeries in their back that come out bad that the insurance company had to make a diagnostic code for that procedure. What does that tell you? It tells you to watch out getting surgery. If you're thinking of surgery, please see a regenerative medicine doctor like myself who can hopefully heal you without a surgery. I have so many people coming in who are ready for a surgery. They have a date picked, and I laugh when I examine them and say, you don't need a surgery. And they go, why are you laughing? And I say, because there's nothing really terrible wrong with you. Your MRI looks bad, but you look good. So a story, I had a gentleman come in about a week ago who I hadn't seen in a year. And he said, Dr. Darrow, you treated me a year ago for my right hip, and it was a miracle. And I said, well, thank you for that. I'm not sure what a miracle means. He said, I don't have any more pain. He said, when I first came in a year ago, you told me you were not going to give me stem cells on my hip because you thought it was so frozen that it wouldn't work and you didn't want to take my money. And I said, well, I don't want to do something for someone if I don't think it's going to work. He said, I called you back later after you sent me home, and I begged you to do the treatment. And I said, this is me personally, Marc Darrow said, if you take all responsibility for this and you understand there's a very low percentage chance you're going to heal, I'll do it. He came back. We injected stem cells into his hip. He said he was completely healed, full range of motion, and no pain. So when he came back, I said, what happened? Did that stem cell therapy I gave you fail later? He says, no, now I'm here for the other hip. So we did that. The hip that I worked on is still good. So I never know who's going to heal and who's not going to heal. I have to be honest about that. I've had people that have had things that weren't that bad, and I thought they would heal and they didn't, and then vice versa. So this person with the osteoarthritis in the right knee, I do that all day long. We do a lot of knees, and people that have arthritis that have these big effusions in their knee. Effusion just means fluid in the knee, which is typically hyaluronic acid that the knee produces to lubricate, so the bones can be smoothly mobile. But unfortunately, when there's arthritis, there's a plethora or an excess amount of this hyaluronic acid. What most doctors do, they'll inject hyaluronic acid, which to me is like brain dead. Why are you going to put more in where there's already too much causing pain? Doesn't make sense to me. But that's traditional medicine. I don't do that procedure. I don't inject hyaluronic acid. When we do platelets or stem cells, which we get from your body, that helps create a little bit of hyaluronic acid right there, the natural way. I like to do things naturally, right? I'm going to give out the phone number to the studio. It's 866-870-5752. Please call me and ask me any questions you want about musculoskeletal orthopedic medicine. Again, it's 866-870-5752. And you can always go to the website to email me. Every page has a slot to email me. and that's www.lastemcells.com. If you call in now, you get a free copy of my book, $25 book, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. So another question, if you don't mind, Nita, unless you have something to say.
Let's do it. Let's do it.
Okay. This question is all about, what does it say, lower back issues, neuropathy in legs and feet. Okay. So the person emails in from the website and says, would like a consult. Have been genuinely impressed with your radio show and the information on your website. Thank you. My problem area is my lower back at L4 and L5 vertebrae. I have neuropathy in both legs and feet. I saw 2 surgeons through Loma Linda University Healthcare. They would use plates and screws to stabilize my spine. Quite frankly, I believe your procedures make much more sense for true recovery and wellness. Thank you. He gave his name and his phone number. I won't give that out. But I did get a hold of this person, gave him a lot of information, waiting for him to come into the office. So what's my 2 cents on all this? The back pain that he's got, we usually don't have a problem healing, because most back pain really is from the ligaments that are sprained. So when people have, I use this as an analogy, when you have a sprained ankle, it hurts like the dickens. It swells up, often gets black and blue, and very, very painful for 6 or 8 weeks, and then kind of heals on its own. Those are typically the anterior talofibular ligament or the deltoid ligaments in the ankles that get sprained. We've got this, for me, a 6-foot body on this little ankle, and it's easy to sprain. I've sprained my ankles endless times running, hiking in the mountains, all of that. Most people that come into my office have had an ankle sprain. Some have not. And when I tell them, hang on, I'm going to sneeze, I think.
Okay, you may. Oh, the sneeze brought us good luck because we have a caller on hold.
Okay. Let me just finish this up,
and
then we'll get to Russell. Russell, don't get anywhere because you got a great question there. But my point is this thing about getting plates and screws in the back, that's called a fusion. Those don't always work too well. And the person says they have neuropathy in their legs and feet. You really have to do, if you have any symptoms, you have back pain and you have symptoms down the legs, you've got to do an EMG and a nerve conduction study. That's an electromyogram and a nerve conduction study to find out if it's really a neuropathy, which is generally caused by overuse of alcohol or diabetes. Those are the 2 main causes. It can be chemically induced. Or it could be a pinched nerve in the back, what we call a radiculopathy. So before anyone gets a back surgery, neck surgery, you better get that study done. They used to do them when I first started out, and I don't see surgeons doing them anymore. I don't know why. Anyway, Dr. Marc Darrow here. We're going to go to Russell in Montebello. Your wife needs a complete knee replacement, according to what the call screener says here. So, Russell, why don't you tell me the history here? How old is your wife?
She's 62.
Okay. And I assume she had an MRI, and it showed that she has arthritis in her knee. Is that correct or not correct?
Yeah, probably yes. Arthritis is in her family.
Okay.
My main question is, as far as MRI, sir.
Yes.
Would you do complete knee surgery without looking at MRI?
I personally wouldn't do a complete knee replacement with an MRI or without it. I'm not for those surgeries. I get too many people that come in who have terrible results with knee replacements. I'm not saying everybody. Okay. Some people do great. But I started out the show saying I'm not a gambler. If we can fix something naturally, that's the way to go. My first law of medicine is do no harm. That's the law of medicine. Please hang with us, Russell. We're going to go to the break. Anyone who wants to call in after the break, it's 866-870-5752. And my office number, if you want to get a hold of me there, is 800-300-9300.
And you're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.